Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us off into the week. First, what's most urgent? Across the United States, hospitals are witnessing a surge in emergency room visits related to a relatively new veterinary sedative containing fentanyl. The drug, Medetomidine, is not approved for use in humans and is causing more severe symptoms than comparable drugs. Hospital ICUs are seeing a fresh wave of patients with life-threatening withdrawal symptoms like severe hypertension and tachycardia. Patients who survive the withdrawal often leave the ICU with long-lasting brain damage. While Medetomidine has entered the drug supply of about a dozen states, it is not yet recognized as a diagnosis, so treatment cannot be reimbursed by insurance companies. Healthcare providers should be aware of this drug and watch for shifting signs and symptoms as the drug supply changes. Rural hospitals may not be as financially equipped to respond to these crises, especially without the reimbursement they need for the expensive life-saving treatment. While rural areas usually have lower addiction rates than urban areas, people living in rural areas are at greater risk of death from drug overdose. Now on to the damage report. In 2025, 23 hospitals have closed so far. Most recently, closures include Heights University Hospital in Jersey City, Cal West Regional Hospital in Texas, Landmark Hospital in Cape Girardeau, emergency services at Banner McKee Medical Center in Loveland, Colorado, and Glenn Medical Center in Willows, California. We find common themes in both the cause and the result of these closures. The cause is usually cited to the volatility of the healthcare market and the unsustainable future of reimbursement from government payers like Medicaid. The effect is devastation in rural communities, but most keenly felt in those rural neighborhoods where the next option for care is nowhere near home. Now for our success story. A recent study found that the default annual mammogram schedule could become a thing of the past. The Journal of the American Medical Association found that tailored breast cancer screening may be more effective for detecting cancer in early stages. For some women in this study, they were found to be low risk based on factors like genetics, lifestyle, and medical history, and didn't need the screening until at a later age. Other women were found to be high risk and recommended more frequent monitoring. The study included a group of 14,000 women receiving this tailored care and another 14,000 undergoing the regular annual mammograms. Overall, risk-based screening was proven to detect cancer earlier and help prevent certain risks from becoming more serious concerns. While more research needs to be done before formal guidelines can be formed, the study suggests a more personalized future for breast cancer screening. Thank you for our sources for this episode: Becker's Healthcare Review, the Centers for Disease Control, Cal West, Landmark Hospitals, The Guardian, and United Press International.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.